I want to talk about some positions that can be helpful for breastfeeding. Breastfeeding can be very daunting, but it's not something that needs to be scary. With proper preparation and a little bit of work once baby gets here, it can be a great experience. I would highly suggest that before you even watch this video, keep in mind that a lactation consultant is going to be your number one tool in having the best breastfeeding experience that you can. A lot of times they'll have them in the hospital, but sometimes that can be a little bit difficult to maneuver just because a lot of new things are happening. So it might be good to find an independent lactation consultant who can come to your home and can help you with your latch and help you to feel like you are doing what you're supposed to be doing and not feel so confused about what's going on. So we're going to talk about a couple of different positions with my baby friend here. Let me pull this down a little bit. So I feel like the best position after you have your baby, just in getting used to how your baby latches and how nursing actually works, would be the cross cradle position. This is cradling your baby. So a cross cradle would be the opposite arm, butt into your elbow here, holding their head like this. Obviously this baby's very small, but kind of this type of position, and then this way. So the baby's laying across your body, tummy to tummy always. You can manage your breast by holding it with this hand, which I think is critical in the first couple days, because if you're doing cradle and you're trying to hold your breast with this hand, it can be very difficult to maneuver and try to figure that out. So doing this cross cradle and holding it this way with the baby here is a great way to start. Another really helpful position for the first few weeks as you both are learning how to breastfeed is the football hold. Just like you would hold a football, like this. Obviously not so roughly with your newborn baby, but with this pretend baby we can pretend. Hold the baby here like you're going to be running with it like a football, and bring your baby to your breast. Never go breast to baby, because then you're going to be like this and it's really uncomfortable. So lean back in your chair. Ooh, this chair's a little far leaning. Bring baby to breast, nose to nipple, and have your baby open their mouth wide and then latch on that way. This can be really helpful because you feel like you have more control of their head, which obviously in the first couple weeks is kind of like a little wiggly. Hold your breast with this hand and maneuver your breast into the baby's mouth and helping them to open their mouth wide enough to latch. So that's another great option. Another thing that I had talked about before is the cradle position. This position is more helpful when baby gets bigger. So it's not something that I recommend right away until you feel like you have gotten really, really used to nursing and you feel like it's something that you're comfortable doing. Because at this point, the baby has head control, your latch is probably great, baby's gaining weight, and you feel more confident in what you're doing. So, bring baby here, same kind of thing, cradling baby. This baby's so tiny, so it looks weird, but you can maneuver your breast with this hand, or you can just hold your baby, because at this point they'll probably be able to latch on pretty simply by themselves. And that's the cradle position. So a few ways that your baby has a good latch. I'm going to move this again. I think one of the mainly helpful ways for me as a doula, if I hear this, I know that something needs to change. You don't want a clicking sound. When the baby latches onto your nipple, they have their tongue makes this like rounded U shape, and the suckle is very strong. So you're not hearing them unsuck, which is what that clicking sound is. It's kind of like I don't even know how to explain it. It just sounds like a clicking. And that's they're unsucking on your nipple, which can be extremely painful for you and can cause, bleeding and among other things. So it's not something that you want. If you're hearing clicking, take the baby off and you need to try to relatch again. What you do want to hear is in the back of their throat, when they suck, they make a k sound, and it kind of sounds, it's like a really, really soft swallowing sound. Just like if you were to swallow, you make a little sound. Babies make it a little bit louder, and it just sounds like a very soft k. And that is helpful with knowing that your baby is taking food in and not necessarily just air, because sometimes if it's air, it's more the clicking sound than the cuss sound. So that's a basic way that you know that your latch is on point. If you feel like you are in extreme pain when you're nursing, or you don't feel like the baby has enough of your areola in their mouth, you need to start over, nipple to nose, have that baby open their mouth really wide, and latch on again. It's okay if you have to do it a million times. They'll learn, you'll learn what's comfortable. And then just go from there. Like I said at the beginning of this video, if you do feel like you need more support, please call somebody. Don't wait, because it can be extremely painful. And there's no reason, other than the first, couple of days of discomfort and nipple soreness, there's no reason to be in extreme pain for weeks and months at a time. So get the help that you need, and don't feel embarrassed or unsure about reaching out.